Okay, let's go.
All right, this is Tuesday, October 18th meeting of the Berlin Board of Health. It's going to be conducted by Zoom and will be recorded, and anybody and everybody that wants to participate will be given that opportunity. And yada, 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 which we've heard a number of times over the last 2 years. Okay. The whole mattress deal. There was a miscommunication between myself and East Coast Compactor. Each of us thought the other had put the order in for the container. Neither one of us did.
Okay.
So they have put a rush on it. It's nothing that I think we should be concerned about because we have one, if not two, storage containers at the transfer station that we can put mattresses in. And we can also rent a box from BP in the interim, which is likely to be 4 or 5 weeks. I'm waiting to hear on what that lead time is. So there's nothing critical there. East Coast and I both learned some lessons here. And we're just gonna, we will be just moving forward.
Paul,
Yes,
Donna, do you still remember the amount of mattresses from the last count that you and I did for like over the last 2 months?
10, I think. Between
Yeah,
mattresses and box springs, I think it was 10.
Okay, it was more than I thought, so I
Right.
thought we should share with Paul.
Okay. Yep.
good information. I mean, on our last BP bill, we got dinged for 3 of them.
Yeah. That's what made me look back because I'm like, there were a lot more. That's why Sue and I
Right,
talked about
right.
it. So,
So I am going to talk to Pete tomorrow or Thursday. I was supposed to meet with Kristen tomorrow, but she moved it to Thursday. I may want to meet with her before I do anything. But I was going to have Pete use one of his guys on Saturday just to make sure one of those storage containers is empty and clean and we can put mattresses in it. I think what we need to, at this point, do and make public is we have to discuss, do we only want to accept mattresses on a Saturday? Or are we willing to accept them on Tuesday and Wednesday when we only have one person at the transfer station? Any thoughts?
I think Saturday makes the most sense, just. I mean,
Yeah.
it's just me.
No, I agree, because at least there's another person available.
Right.
Yeah, and we're gonna you know, ask the public. They need to help with that, but the public and one of our guys should be able to handle just about anything that comes in.
Yeah, because remember, they get it on or in their vehicle.
Yep,
We're not there to help.
exactly. Well, we don't know what they have for help on the home site, but that the point is well taken, and I think we will just do that. We're gonna have to go online, publicize that online, that it's gonna be Saturdays only for
Right.
mattresses
Sure.
and box springs.
Yeah.
And we will currently, I guess, stay at the $50 per piece price.
Okay,
On another matter, Brenna Ewing approached me about she has a couple renting a room for her. Now, I know Sue's familiar with this, and Pete brought it to our attention. And the question is, does that make the fact that they're renting a room, does that make Brenna's a two-family? Does it make it an extended family? She told me Saturday at the transfer station that she receives no rental income from them, and that it's a barter system. Now, barter is another form of cash, but she maintains that she should be able to get a second sticker at the $30 or whatever it is, rather than a full price sticker. And I told her, I said, well, one of your tenants claimed that they were paying rent. And she said that wasn't true. And I said, well, need to see something in writing that both you and your tenant sign to kind of clarify what this situation is. So that's lingering, and be aware of it. I don't know if we can decide on anything about that tonight. We need more information.
Well, I'll be the bad person here and say that I'm pretty sure our form says multi-unit dwellings. And we don't specify whether it's a 1-bedroom or 2-bedroom or 3-bedroom apartment. It could be a studio. But when you have a different set of people in a house, I don't see why they get away with not having to pay for a sticker. I mean, it's different if your mother comes and lives with you.
Right.
It just didn't sound like her kids or extended family, so.
No, she told me that they were a couple from Boston, that they were city dwellers and getting used to country living or something to that effect, so.
So who would just go and say, oh yeah, people off the street, I'll give you a room. You don't have to pay.
Could be a slippery slope for sure.
That, well, I'm saying right now, I would consider that a multi-unit.
Yeah. Yeah,
Okay.
because
Bobby,
I
you
have,
think so?
I have 2 tenants upstairs.
I don't
so-
know. I'm a little conflicted. I mean, I agree that it's not family or anything like that, but if there's no separate apartment or utilities except for a bedroom, it's the same household. You know what I mean? It'd be just like
Yeah,
having another kid, another person come back to live with you, like you say, mother or something, but it's something I think we're gonna have to think about or figure it out, because being one household, like you say, if there was an efficiency actually built in with other utilities and a separate trash and separate cooking and the whole schmeal, I think they should have a separate sticker. If it's just a room they're renting, or same household, it's just adding, I don't know.
No, I
I'd have to
hear
think about it.
you. Those are good points. I guess I'm of the mind right now just to let sleeping dogs lie, see what kind of communication we get, and not make a decision tonight.
It could be gone tomorrow.
That door it's a tricky door. It swings both ways.
Yeah,
If it's not a separate mailing address or,
unit 1 or 2.
I
right.
just,
Yeah.
the part that gets me, and I originally was in favor, certainly, and probably still am, that there's a separate sticker involved. Is because one, because of the way it was handled, and 2, this is an odd category. We've never addressed this category before.
It is.
So,
No, we haven't. All right.
so until we get further information, we got 4 minutes before Victoria. I've had a couple conversations with Fred Cummings from Highway, relative to our transfer station wall issue and the sinkholes and the pavement and so forth. And I talked with Fred today, and he gave me some general material costs, because he thought capital planning numbers had to be in the capital planning this coming Monday. And I don't know if that's so or not. I've missed that. I'm meeting with Kristen. It was supposed to be tomorrow. It's going to be Thursday now, and I'm going to find out. But Fred's thought, because he and I had met with a contractor from Clinton who originally seemed interested, and he was somebody who does kind of difficult jobs. Well, we never really heard back. So Fred has taken it upon himself to price out some materials and include highway department doing a lot of the work. And that would be all of these stone walls that are retaining walls by the compactors, by the open top, would be removed and replaced with modular concrete block walls, 2x2x4 concrete blocks.
Oh, yeah.
There would need to be some excavation down, a concrete footing put in, and blocks placed on top of it. Now, the cost of materials to do the section of wall where the open top is roughly $3,000. The cost of blocks to continue on to where the metal container is another $12,000 or $13,000. There would be some subcontract work to a Mike Sawyer or Paul Wheeler or somebody hopefully local, with highway doing the majority of the work. So he's gonna corral those numbers a little bit more, get back to me, and I will proceed to approach FinCom or Kristen or whoever I have to relative to the capital planning. I think it's going to be FinCom. And I asked Fred to kind of break it up in stages as best he could so that we can talk about that. Maybe we do a chunk this year, a chunk next year, spread it out over 2 or 3 years. But ultimately, it has to be done because these sinkholes will continue, and then we'll be looking at a more major asphalt repair up on top.
Yeah.
So, he's working on that and in communication with me, and I think we should be very thankful that he's taken it upon himself to take some action on this. All right, I have 7:15, which would mean Victoria is on. Hello, Victoria.
Hi, Victoria.
Hello.
Hello.
Hi there.
Happy Tuesday to you all.
You too.
The floor is yours.
All right. So I don't know if you've seen my other meetings. I tend to do a little PowerPoint presentation to help kind of guide me. So this is not new, but I figured just for tonight, we will do this. And if you have any questions, just let me know.
Okay.
So this is, we're just going to be talking about mobile harm reduction and the syringe services programs that are available in the state. So let me just do this. Yeah. So just talking in general about opiate use in the state of Massachusetts. In Mass, back in 2014, the state did rule that any opiate disorders and opiate use has been deemed a public health emergency, just due to the rising number of overdoses and just usage in general. And what the state wound up doing was in 2018, they formed a committee to address the various opiate use disorders. So the goal really was for this committee, using various people throughout the state, was really to look at different evidence-based practices that other states and other areas have tried to try to address the situation, because unfortunately, as you all are aware, substance use, mental health issues, they're prevalent everywhere. And unfortunately, especially now that we're heading in towards wintertime, we may start to see more of an increase of numbers. And coincidentally, they had found that with different services, it looks like that opiate deaths actually did go down in the state between 2016 and 2018. So just again, some other information for them to try to kickstart to the towns. So when I had met with Neshoba Boards of Health with Tamara Bedard and Jenna Montgomery over the summer, they were talking to me about this program that the state is launching, as well as they're also getting trained for opiate overdoses, particularly fentanyl, because it seems like especially heading up more towards like Middlesex County, up in that coast area, that there's a lot of fentanyl overdoses on the rise, and it's unfortunately being mixed with other substances and chemicals, which is resulting in people, unfortunately, either overdosing or passing away from it, which it's scary to think about, but something that is on their radar. So in general, what we're looking at is the Department of Mental Health is currently launching this harm reduction in service syringe programs. And as of July, there are 62 cities and towns that have signed up for it. And basically what DPH is trying to do is it is trying to get services and supplies to area cities and towns for free. It means that they're basically footing the bill as a trial, as a beta test to see if this can be ongoing. The harm reduction services includes, any syringe services, which is access and disposal for needles, any Narcan or naloxone, which is what our police and EMS have on them to address any type of opiate overdose when they go out to calls. It's also talking about basically education and prevention as well for any kind of substance use disorder. And some testing sites are also having HIV or hepatitis testing, because unfortunately, when you are using substances and your needles may or may not be clean, or there may be sharing, there is a higher risk of additional health issues that then add on to cities and towns as well. Myself, along with public safety, are there as well to help hand out any additional resources that may be more specifically tied to our area or things of that nature as well. But I wanted to show you guys, this is basically what the state has so far. So this shows you where the syringe service programs are going currently. These areas here in red, with AIDS Project Worcester being our local one, is basically sites that the state funds or helps to fund as resources for those who are looking for, a detox. They're free services beyond your normal detoxes or your normal hospitalizations. These services here, they're not necessarily providing crisis work like somebody who may be actively discharging, but they are there as a resource for people, especially those who may be lower income or those who may be, very fearful of, potentially like immigration status or, information being leaked out to other people. And these blue circles here are the mobile harm reduction. So these cities and towns have basically partnered up with the state and said, yes, like we're willing to try this. And these areas basically share a clinic. So the way that it works with them is, I'm going to show you just this example for Berkshire County, is that they have their own harm reduction schedule. So these units aren't necessarily stationed in one particular city or town, but what it does do is regionally, it does go around, and it can, for the towns that have agreed to use it, it can be there as the additional resource for the town. In Berlin's case, because again, we are a very, very small town, and we don't, we are not necessarily seeing the wide scale of the issue as, say, a bigger city in the state. We would, again, kind of be something like this, like probably like a stop on the mobile kind of schedule. But this, like I said, is just giving you guys like an example of what has been set up already in terms of like Berkshire County. So the goal would,
Excuse me, Victoria, I need to interrupt you. You mentioned something with blue circles around things,
Yeah.
and I'm not seeing that on my screen. Am I
Uh,
missing
oh,
something?
it's right
No,
here.
I'm not either, Paul.
Can you see it now?
No,
No,
Oh,
All right, hold on just a sec. Let me see if I can zoom. There we go.
it's been the same screen from the get-go.
It's not
We got-
flipping.
well, we got down to the Berkshire Health System.
The last line is
And that's it.
example, Berkshire County Harm
Let me do this.
Reduction.
Hold on just a sec. Let me do
Yep.
this,
Okay,
just so you guys can see. Okay. All right. How's this?
oh,
Ah,
hey,
but,
There we go.
good.
There we
Okay.
Yep.
go.
no, you
Well,
got
I
the-
apologize. PowerPoint did not want to share my screen with it. Did not want to get on the screen.
That's all
I'm,
right.
I'm gonna ask you to revisit what you were saying, because now
Yep.
now
Nope,
we
I
have a
get you.
visual.
That's fine. So over here, this hub here is AIDS Project Worcester. So
Yep.
this is one of the local resources that we have for Worcester County and for Berlin, for those who are looking to get
Mhm.
this public health system, public health education, supplies, things of that nature. As you guys can kind of see here, Framingham's the next one, but
Mhm.
they usually tend to service, I think, Greater Metro West.
Mhm.
If you can notice, we are kind of like beyond Worcester, we're kind of in a empty pigeonhole over here. Like there's
Yeah,
not
no
much.
man's land.
Right, and that is a huge problem. These little blue circles here are the mobile clinic.
Oh, okay.
So,
Oh, wow.
so these are basically the cities and towns. So like Berkshire County
Wow.
as a whole has signed up for this type of program. They're doing another trial out towards Hampden and Hampshire County. Lowell is a hub site for upper Middlesex County, and then basically
Yeah.
all surrounding Boston. Salem has one up here in upper Essex County, and then the next hub is basically down towards the South Shore.
Well,
So you can, like I was saying, like this is part of the problem, is that we're in a desert kind of for services,
Mhm.
which makes it
Wow.
hard. And
Yep.
I can speak from personal experience, having worked in hospital rooms, having worked in hospitals, emergency rooms, that even pre-pandemic, trying to get the resources needed for individuals was a challenge. With COVID, it's now almost impossible, because a lot of these units have, they may have either like cut down the beds that they're offering or the supports that they're offering because budgets have been cut. They may have lost staff and they haven't been able to replenish the staff.
Mm.
Or unfortunately, some agencies just haven't been able to continue getting the funding that they've needed. And if you don't get your funding, you can't keep your doors open. So, like I said, we were in a tricky area to begin with, but this, I think, kind of highlights why, having, more than, one source of, for this is really important. So now what I'm going to do is I'll get out of this and I'm going to show you. This is what Berkshire County is doing. So this is what I was just trying to show you guys with this clinic. So what they are doing is that the Berkshire County does have a mobile unit. And what they do is they have planned stops in each of the cities and towns that have signed up to be part of the clinic. So like, for example, here you're looking like generally like at Peru or Sandusfield or Windsor. They're basically going like once a month as a resource, but this resource once a month is still really important to these cities and towns. Like I was mentioning with Berlin, it may not be something that we are going to need access to constantly, like a bigger city, but it is still really important, because for those cases that we do have, this is just another resource, another option that we can then offer individuals who, are in the process maybe of, really looking into detox programs, or who really, maybe in the contemplation stage and are thinking about, trying to move forward. Does that now make sense from what I'm
Yeah.
saying?
Yeah.
That certainly
would we-
helps.
Would we be co-partnering at all with the police or anything, Christine, to get to, a lot of this information? It's a
Victoria.
lot more than you know about, but it's not publicized, of course.
So let me tell you this. a lot of I'm now up in public safety 2.5 days a week. And most times now I'm hearing about there's, swath of times where there may be, not as many overdoses, but then then I'll come in like one day and I'll be like, yeah, we had 2 calls over the weekend.
Correct.
So
Hmm.
this is not a problem, even though Berlin is a very small town. Mental health, substance use, hoarding, dementia, like these problems are everywhere, unfortunately. And because of that, bigger cities and towns just tend to get more resources because they have more funding. They tend to get more of the support from DPH or DMH, not because they're necessarily doing anything, different, just that the numbers are there. Their populations are at a higher risk and they tend to get more of the attention. But unfortunately, towns like Berlin tend to not, may tend to get, either overlooked or they may not qualify for as much just because of our population size being so small. And that is a concern.
Do we, as a town via police department in conjunction with yourself, do we have any data in terms of, well, let's just call it OD calls for 3 months, 6 months, for any
Yeah.
period of time to try and put a fence around this?
What I can do is, I know when I had worked with public safety earlier in the year, I did get a couple of their, I did get some of their data from earlier in
Okay.
the year,
Mhm.
like earlier in
Okay.
like the previous years, just looking at the, here we go. This is not a complete list, what I'm showing you, but this I think will just give you an idea of just some of the issues that we've been dealing with, of really what they've been dealing with. So let me show
Right.
you the screen. Okay. So this is old. This is just solely based from the data of the annual reports that I could find. So just different, as you guys can see here, just the
Okay.
different calls that they're going on. And these would be considered public safety, especially like mental health calls. These like
Mhm.
these are the categories that I look out for.
Sure.
And look out, like the interesting thing here is that like the well-being checks go up. Unfortunately, just mental health calls, like they started reporting it in 2018, 2019. I can like back, I think this was like towards like the beginning of like May or June, like they were already, decently high. They had 4 calls back towards the beginning of the year when I started looking at this. There's been suicide calls, like they're going up. Like narcotic drug violations and family disputes, these categories I think were condensed in later years. So that's why the data is not the best. But as a
Mhm.
whole, and you can ask Chief Clark and Chief Shartner, you can ask any of them and they're going to tell you that they're going on more and more mental health, well-being, substance related
Right.
calls. Just the numbers are there with them. And like, unfortunately, some course of action can be that then if the person is unconscious, they go to the emergency room, they get their treatment. But then what happens after that is really kind of anybody's guess, because they may be, agreeing for detox and getting, additional services from there, or they may just be discharged home. And part of, I think, what we're trying to work on is just making sure that there's no lag, that, if there's somebody there that's, willing to work with me or willing to get some additional information, we want to get it to them. We want them to have the resources they want. And I understand too, Berlin is a very small town. And I know that sometimes in smaller towns, people tend to be more private, more secretive, and, don't want people knowing their business, which again, I understand. But with this, it's like, everybody's goal is to just keep everybody safe and sound.
Yeah, being
And
private doesn't make the problem go away.
no, unfortunately, it makes it worse most of the time.
I guess what I want to say about this is that at some point where the rubber meets the road, there's going to be a financial ask or commitment to get involved in a program, which is all well and good. But having been a veteran of some financial ask, the more data we have, obviously, it's stronger ammunition in terms of completing a
Mhm.
successful ask for assistance.
So
So,
that's part of what this is also looking at as well. So
okay,
for tonight, if you guys were on board with this, really all you're looking to do is to submit a letter to the state saying that we are willing to pilot this. We're willing to, again, this is a free program. You're willing to have Berlin be a trial. It's not saying that, what's going to come of this later on. I don't know. From the
right,
meetings
okay.
that I'm going into, it does not sound like this is going to be going away, because unfortunately, like, these opiate issues are not going away.
No, they're not, no.
And I think it's going to get worse before it gets better. Really, what we're also looking into as well is that the town, like every other city and town in Massachusetts, is getting opiate funding through the I
Right.
believe like the OxyContin and the bigger companies, that when they're settling their lawsuits, the money is being funneled into the town. Now, part of what we do with that money is education and prevention, and really just trying to get that word out there to our residents. But the thing is, like, if we had the opportunity to get a program like this and we said, no, we don't want it, I don't want that to come back and bite us later in case we ever did need funding from the state. If you kind of go into this, like, open-minded, like, yep, okay, like, we're willing to try this. It may or may not, it may make a big difference, it may not, but at this point, it's not costing the town anything. And it's just another avenue, it's another resource, especially for our public safety, where they're going on these calls and they don't necessarily have the time and the ability to manage these calls in the same way that, DPH might be able to take their, wider lens on.
Sure, okay.
So, like I said,
So-
it sounds like the opiate funding is going to continue to be coming in. This is not, I believe the towns, I think, got anywhere from like $3,000 to $8,000 so far. And I mean, from the meeting I sat back on in July, it sounds like that funding is going to be coming in for at least another like 3 to 5 years. So, and that money, hypothetically, like, if this program is like something we wanted to, like, get really gung ho behind, we would have funding there that has to be designated for opiate, opiate relief.
Narcotics. Now, is this a lot of follow-up service, like from after someone's discharged, Christine? Is that where it starts coming in, really, is after an issue? Or try to prevent it, of course, but after an issue, you do follow-up with the people, or is?
So it's kind of a two-prong approach. The mobile clinics, they do have, resources available to them for detoxes for people as they would want it. Unfortunately, part of it as well is, with any kind of substance abuse issue, is that until people are ready to get the treatment that they need, you do your best you can, but the likelihood of it being successful is small. So part of what this clinic also has too is with the harm reduction is, again, like, are people aware of what Narcan is? Do they know how to use it? Do they, making sure that we have, the clean needle exchange to make sure that, like, there is nothing being left behind, that we have that, resource out there. Again, giving people education on other health issues that could be, a co-contributor to this. So, and I do think a lot of this is going to be some follow-up. There are a couple agencies that DMH is really pushing, to work with public safeties about when you have substance abuse calls. But unfortunately, some of these bigger agencies, like the one agency I can think of that Berlin is assigned to, is based in Gardner, and they're covering 45 towns. And it's like, while the idea of it's wonderful, it's like, how logical, or how feasible is it really going to be that this is going to be able to make an impact for Berlin? Odds are small with that, just because there's so many other areas that they have to cover.
So at this point, what you're asking or suggesting is that the Berlin Board of Health send a letter to the DPH stipulating that our Board of Health is open to whatever state, federal resources are available for these programs, correct?
Yes, yes. So the letter that I will send you is talking about, you know, the mobile harm clinic and the syringe services programs. But it also, like I said, I suspect that that is also going to grow as more and more cities and towns start to sign up for it.
Now, do
Have
you
a
have,
template?
sorry, go ahead, Sue.
Do you have a template for this letter for us to send to the DPH?
Yes, I will get it to you and send it over.
Okay, that was gonna be my question too. Thank you. Yep, excellent. Yeah, well, I don't think it's anything the board needs to vote on. I'll just ask for a general consensus. Strikes me that it's a good, definitely a good idea to follow up on. Bobby, Sue, any thoughts?
I'm all
I'm-
for it. I lost my son to drug overdose, so
Yeah,
I'm
okay.
behind it.
I'm
Yeah,
for it.
so
I have no problem
Victoria,
with
if
it.
you get us that template, we will definitely send it in, and thank you for
Sure.
this work and update.
And just to let you guys know too, Chief Shartner and I are working with a local person too to get Naranon groups going. And Naranon is Narcotics Anonymous support for families and loved ones for those dealing with substance use. So we are also trying to get that going as well,
Okay.
you know, as a support to, you know, Berliners and people in our general area as another resource for them. Because, you know, while I think a lot of these resources are trying to do filling the gaps for those who may be, you know, dealing with this addiction, it's like, but what about those who are impacted by their loved one?
Right,
And,
right.
you know, that's, you know, something that we're also just trying to be, you know,
There's a cascade effect. It's not just an individual situation, right?
Billy, did you have anything to comment?
No, I had talked to Victoria about this in the office and
Yeah.
if there's help out there and why not take advantage of it?
Absolutely.
Right, certainly. Thanks for the hard work, Victoria.
thank you all. So any other questions, just let me know and I will be getting you guys that template.
Very good. Thank you.
Thank
Have
you
a
all.
good night.
Thank
You
you.
too.
Okay,
Hi,
we're
Bill.
Hello.
running a little late. We have a hearing at 7:30.
Oh, Did you
Oh,
get?
Yeah, I
your feelings
apologize
done?
for my tardiness. We had 6:20 appointments and things were a little slow at the clinic, so I'm here now.
Okay,
Did you?
Bill,
Did you?
we have a Mark Adams, a Douglas, and a Mike Quirk in the audience. Are any of those?
Well, if we're gonna take care of our hearing at 7:30, 272 West Street would be Douglas.
All right, let's go with that one.
And Sue, you should have a plan for this from Steve Sears.
I do.
And we already got the publicized things, correct?
Steve dropped off the green cards today and he said that Douglas
Okay.
would be dropping off the newspaper article.
You all seeing this?
Or I should say the newspaper notice.
I did see
Um,
it, Sue.
I'm not seeing anything other than you guys.
No,
I'm looking at Paul.
Yeah, I'm looking at Bill, myself.
Hi.
Oh, that's
Well, this
not.
Douglas.
And there's
Hey
Douglas.
guys, how are you?
Douglas.
Let me get back to where I belong here. There's a magic button I'm supposed to push somewhere. There you are.
I don't know which one.
that?
Oh,
There we
you
go.
Yeah,
Good job. Sweet.
Yeah,
That's actually,
That's not
yeah,
mine.
that's it.
that's a different plan.
oh,
Yeah,
that's
the-
being
Well, this
powered.
is lot, yeah,
That's
that's,
a change.
yeah, that's Powers Road. That's later on in the agenda.
Douglas, do you have those plans up on your screen?
I do not.
Okay,
I think I see him up on the left there, Sue.
no, this is all,
Yeah, that one, is that it? No,
No, that's what we're looking at.
okay.
Those were Seth Donahue's plans.
Yep, that will be later tonight. These would have been from Steve Sears, probably a couple weeks ago.
Is that Highland Street though?
Which, what?
This one we're looking at here? No.
Powers Road?
Oh, Powers at New Lot, yeah. No, I don't know. Scuba dooba doo.
I found them.
Beautiful.
Yeah, so we're gonna want sheet 2.
There you go. You got it.
And
Well-
this
Perfect.
is almost across from the Flat Penny on West Street.
Yep. Yep.
And if you recall, Douglas met with the board to determine if they would allow the upgrade to be for 3 or 4 bedrooms. And he showed us, what the house was, what it is now, and what he'd like to do. And the board did, say that they would consider it as a 4-bedroom upgrade. So that's what we're here to discuss tonight. You can
It
see.
looks like you're gonna dismantle the old system, Billy, and put the other one in.
Well, if you look, that square towards the right of the screen is the proposed leaching bed. And you can see the 2 circles within that. That's the existing,
Oh,
the
yeah.
series of cesspools there. So those will be removed and replaced with clean fill prior to the installation of the leach bed.
Or a series of cesspools. I
Yep,
don't know if
You can
I've
see
run
one's
into
called
that
a
before.
cesspool, one's called an overflow. So that's how they
Ah,
used to do it.
All right.
When the cesspool got
was there a
tired, they
tank-
put another one in.
Yeah,
right. Was there a tank before that? There wasn't, right, Billy? That.
No,
after
no,
that-
a cesspool is, well, actually, that's the first cesspool actually almost became a tank when the
Tank.
second one was put in.
Exactly, okay, yep.
So I can run through the, Steve Sears may or may not be available by phone, but, well, he is available by phone. I just don't know if he's called into the meeting. But I can
He
run
actually
through
was
the
gonna
area.
do it with us tonight, I guess. So I don't know if he's on the audience.
We
Let
can
me
buzz
see.
through it.
do we have
Yeah.
any questions for Steve at this point?
Well, I can run through the variances.
Let's do that.
Right,
So local, 3N, no reserve area. Again, it's an upgrade.
Yep.
4D, 2 perk tests. We did 1.
okay,
It's 2-minute soil, sand and gravel. 4F, leach area offset to well. Obviously the existing well's in the center of the lot, and the proposed leach bed is 51 feet from the well. And the local upgrade approval allows us to be as close as 50. So
right.
do we lose the plan?
Yeah, I think we lost the plan.
I can bring it back up. I didn't throw it out. I get lost sometimes here under mail.
Oh. At least you can do it, so I couldn't probably get it up there, so.
Okay, page 2. And all right, so where do you want to go?
That page 2 that showed the house and proposed system.
You mean page 1?
No, sheet 2 of the plan that was up earlier.
Yep, this is it.
We're not seeing it.
That's because I forgot the magic button. And sometimes it gets lost. Zoom button. All right. All right, keep talking, Bill.
Well, we can continue.
Yeah,
So again,
Okay.
leach field less than 100 to the well, 51 is proposed, 50 is allowed through local upgrade approval.
okay.
Leach field to foundation, 20 feet required, 12-foot proposed. Again, that's allowed under the local upgrade approval. And a local offset, 25 feet from property line, road line, and it's 18 proposed. Title V is 10.
Okay,
So those are the local variances, and again,
Yeah.
the local upgrade kind of reiterates some of them.
Right.
Again, cellar wall to leach bed 12 versus 20.
Right.
Instead of 100
Could-
feet from well, we've got 51, so you can see the location of the well between the existing home and the proposed addition. Unfortunately, it's kind of in the center of the lot, so
Oh, yeah, okay.
they're able to meet that 50 minimum, but not the 100. Obviously, there'll be a water test done as part of the upgrade. And you can see the cesspool wasn't much further. So, it's a better system. It's above the groundwater table and it meets that at least 50-foot minimum. And the
Does it
last,
need a, oh, go ahead, Billy, I'm sorry.
the last local upgrade approval is depth of pump chamber and tank. Because the existing plumbing sets the pump chamber and tank so deep, when the breakout elevation is held for the bed, it places those components greater than 3 feet deep. So the code does allow that for upgrades. Both components have to be H20 loading because of that extra earthen cover, but it is allowed. So
Okay,
that's what's being proposed.
so
Now,
basically it's a lower,
if I'm standing in the Flat Penny parking lot,
Yep,
which house is this? Which
it
property?
would be diagonally right, like you've got the package store. I
Yeah.
think there's
The
a
little
house
house.
that's, I think, 268. And I think this is the next one, Douglas, you can correct me if I'm wrong, is 272.
It's just 72.
Is this a split level?
no, that says,
No.
one just before that. Paul.
Nope, it's just before
Sounds
that.
like, okay, all right,
That's 2-story.
yep.
Just before that. So it doesn't need a breakout barrier, right, Billy, because it is
No,
set low and
No, it meets breakout.
state, in its state, I mean, to the house, right? And it's like state, it's under state rules, right? I mean,
Well, the local upgrade approval allows the board to relax the 20-foot minimum and they're
Right.
proposing 12. Again, very
Yeah.
pervious soil, so the odds of horizontal migration towards the foundation is unlikely.
right, and you said the bed's pretty low too, actually, also, so.
Well,
we're
it's a
hoping it might-
maintaining a 5-foot groundwater offset because of the 2-minute perk.
Yep.
So it is a bit of a change in grade. You can see there's a 98 proposed contour over the 96. So, 2 to 3
not
foot
bad.
change.
No, it looks good to me, I don't know, considering you're getting it in there.
Yes,
I
I don't know
have
if the
no
board has
problem.
any questions. If not, you can vote on the variances and I'll draft a permit if approved.
I don't have any questions, and certainly it's an improvement over two cesspools in series.
Yeah.
I don't have any questions.
I'll make a motion
Okay, go ahead.
to pass all variances requested.
I can second that motion.
All right, we'll do a roll call. All in favor, Bobby,
I,
Sue,
Aye.
Paul, I as well. The variances are accepted.
Yeah, and just to let you know, the bottom of those cesspools were probably close to groundwater, where now we've got a full 5-foot offset to the bottom of that bed, which is a vast
nice,
improvement.
Big
Yep.
improvement, yes, yep.
very good.
Okay.
All right.
You're all set, Douglas.
All right, guys. Thank you very much.
So-
Douglas,
Well,
once I
Except-
complete my technical review, a permit will be drafted. I'll be in touch.
Okay.
me just
So
take a quick
just
look.
to clarify that I did send like the notice, the legal notice, confirmation received through the email to the Board of Health, right? Last
Okay.
Friday.
Yeah, we,
Yes,
Yeah, we
I
got it.
saw that.
Oh, you got it?
Yeah.
Okay, that's good.
yes,
All right,
thank
thank you
you.
very much, guys, and I appreciate all the help.
Okay, have a good night.
You too.
You published that to us, didn't you, Donna?
Yeah, I emailed it to you guys, yeah.
Yep,
Yep,
saw that.
yep.
All right, Mike,
Yeah, I saw it, I think, Donna.
yeah.
Mike Quirk up there, so.
Yeah, I know, I brought him up, and I'm trying to bring up a Mark Adams too, but
Yeah, I guess they can be the honor system, whoever was here first, we could speak to.
Yeah, sorry. If I seem a little stressed out, I just missed like an hour of my two kids open house at school. So
Oh, boy.
I was trying to, I'm on the move
Done
a
it.
little bit. So bear with me. I was sitting in a classroom there at St. John's, but just like the old days. I was sitting alone though. It wasn't detention. So that's good. So, so bear with me, but thanks for having me. I appreciate it. I've talked to Bill a little bit about this project. I can kind of give you details. I'm going to jump in the car as I go. Hold on.
Oh. We can move them.
So, can you still hear me?
Yep,
yes.
All
So
right,
what
so
road
it-
are we talking on?
This is 85 Boylston Road. If you recall, the board discussed this at our in-person meeting on, well, whenever that last meeting was in September that we met in person, if you recall, we had some house plans to look at there. And there's also a question of the ejector pump and tank size.
all right, okay.
So I can, Mike, if you want, I'll kind of give the board the history here.
Yeah.
Maybe you can fill in the blanks.
Yeah, absolutely. It's pretty straightforward, so it should be pretty brief.
Yes, so we had,
Originally, when
the question I think the board raised was, we've got a 3-bedroom septic system. And we've got an existing 3-bedroom house, and your proposal was, I think as we discussed, it was to eliminate a bedroom and create 2 in the basement. So the board's question was, if you have a 3-bedroom house minus 1 gives you 2, plus 2 in the basement brings you up to 4. So I guess the question was, are you losing 2 bedrooms in the existing house?
So, I mean, we're putting it, the goal here, or the offering, is to put a deed restriction on, saying that, you know, in the future, if they were used as more than 3 bedrooms, it would need to be upgraded. So that's one thing, you know, that's concession that we're looking to make. There's currently 4 occupants, 2 kids living in 1 bedroom. The goal is to put a wall in an existing built-out basement, which has a bathroom and an existing ejector pump, and build basically 1 wall downstairs to create 2 bedrooms for the boys. And that's it. We're still same occupants, same usage, nothing
Yes,
really
but what are
changes.
you doing with the room that you're taking the kids out of?
Office. We are gonna need 2 offices. I currently have a record room down at record playing room, like a music room in the basement. We'll use 1 room for that and then 1 room for office. And that's it. It's the same number of occupants. And I suppose the other thing that came up was the ejector pump and needing to, the notion that a 1,500 gallon septic tank would need to be added. I just don't see a lot of,
Well,
You don't see what,
it's actually,
please?
it would be a huge waste. It's a high functioning system. There would be a total waste to rip that out and put in a 1,500 gallon tank.
How do you see that as a waste?
you're adding,
You're protecting
A
your
waste
leach
resource,
field.
waste
You're protecting
materials.
your leach field, which is more expensive than a tank.
Functioning, we don't know how long. Longer up there for 7 years.
We're losing him. I'm not.
The ejector pump's been there for longer than the 7 years we've lived there.
there's a
Do
big
you know when it
down
was
there.
installed? This issue came up in Berlin the other day. The bottom line is, if the ejector pump was installed from 1995 to present, that 1,500 gallon tank requirement was in place as of 1995. The problem with any ejector pump installed prior to 1995 is the code in place at that time did not allow ejector pumps. So you're kind of caught in a non-compliance issue no matter when it was installed. And I've only recently discovered that the 1978 code prohibits pumps prior to tanks.
So what you're saying, Bill, is according to all regulations, he needs a 1,500 gallon tank.
Right, because to say it went in before 95, and let's respect it because it's pre-existing, the code at that time didn't allow them. So, if it did, we'd be having a different conversation. But because I did the research and found the 1978 code, it expressly prohibited the use of a pump prior to a tank. So it either wasn't allowed, or if it was installed after 95, it was done without our approval and without the need of that additional tank being installed. And we still need to determine if it's a non-grinder or a grinder. I mean, if we're going to go that route, we have to determine what type of pump's there, because again, a grinder pump would actually require either 2 tanks in series or a 2 compartment tank. So, that's a question.
I gave you the serial model. We looked at that ejector,
So I think it was a non-grinder.
non-grinder ejector pump.
Yep. So that would require, and again, this was discussed last meeting, a 1,500 gallon tank, which to our knowledge, that dwelling does not have.
Good thing I pulled the permit, tried to work with the town.
Well, you're not the only one that's got caught with this ejector pump issue, so don't feel singled out.
We've done several.
I mean, part of our job, whether you believe it or not, Mike, is to protect existing systems to the best of our ability. And if you're going to have 4 people there, and as the boys get older, there'll be increased usage. And, I'm going to say all we're asking is an upgrade in the tank. I understand money's money, but at the same time, the cost of replacing a septic system is a whole hell of a lot more expensive than replacing a tank. So I'm struggling with your logic a little bit.
My logic is just that nothing's changed from the day before I pulled the permit.
Yeah. Well, we're being,
Well, yeah, you are changing things. You're changing the lay of the land with rooms, adding a bedroom and so forth. So you can't say nothing's changed.
Well, I think it's important to view that what's changed
There's
is,
no occupancy change. There's no occupancy change.
right,
And no flow change.
But the rules are based on rooms and,
we're trying to be consistent, Mike. We've had several of these, the same issue with the ejector, and we've been consistent. They've all had to put the bigger tank in. It's not just you. We've done it. I can't count the number of times we've done this.
I appreciate
Well,
no, I appreciate
if I
that.
could
You don't have
just
to
say-
explain your position. Okay.
We're just trying
what's
to be
changed
consistent.
is you're applying for a building permit, and that brings the property under our microscope, and we've determined that the ejector pump that there is not in compliance.
No, I understand, Bill. I get it.
You're not adding a bathroom, are you? It's already there, Michael?
bathroom doesn't matter anyhow.
No,
But
I
no, it
know.
is pre-existing.
I thought he was
It's
putting another bathroom.
No, it's there.
No.
Yeah, okay.
That's what I meant by nothing's changed. I mean, it's the same. There's
Yeah. But it puts you in the 1,500 gallon because it's known now.
So if we keep the bedrooms the same, just keep everything as is, and then it's moot.
You basically still should have a 1,500 gallon tank. Is that correct, Billy?
Yes, I don't know how far the board will go with that, but we can't act on the building permit until that's agreed upon.
And now that we know, it's very hard to unknow.
Yeah.
Good point.
Like he said, he did it to, trying to do it the right way.
Well, call it catch-22 or whatever, but when you want to do it the right way and you go through the whole permit process, things get triggered, and
Yep.
there may be something that you were not involved in, responsible about, but you as the property owner comes to bear at present time. It's not, we don't look to penalize, we don't look to put anybody out of their home. We bend over backwards to make sure people can stay in the home the way they want, but we have certain rules and regs, state and local, that we have to adhere to. And we try and be consistent so that everybody's treated the same. To make an exception is just not something that's appropriate for the board to do.
We have given time for you to change them. To some of the times we've done it, we've given them enough time to change it out.
Well, the only thing that we could do is verify that tank size. Again, the permit on
Right.
record indicates a 1250. The Title V that was done in 16, the dimensions listed on that Title V calc out to be a 250. But I don't know, Mike, have you had the tank pumped? Have you ever seen a receipt that indicates what they've removed from the tank gallon wise?
I'd have to look. Larry Favreau pumps it. I'd have to
Oh,
look.
yeah.
That might not be a bad place to start, because back in the day when 1250s were required, they were often hard to find, and people would put in 15s because they were easier to find. So if we could determine if your existing tank is a 15, then you'd be in better shape.
Yeah.
All right. Sorry, I'm in the
Larry-
shadows. Sorry, I'm in the shadows.
Oh, I am too.
I'm in the car driving. My wife's
Yeah, I think Larry would probably have a card on you, Michael, if he's pumped it before on, usually they keep a little record.
driving. Yeah, I can call
Favreau.
Larry in the morning.
Yeah. So,
All right.
I guess that would be the next logical step in this process, so no decision until we have a little more verification of size,
Okay,
because that could change things.
so this wasn't a hearing per se, this was just to talk about it, right, Billy?
Well, yeah, based, again, we had that initial discussion, and
Right,
right.
those follow-up questions
we just-
were brought up.
So this is just a follow-up, yeah. We can do another.
All right. Thanks for hearing my comments.
okay.
All right,
Yeah, let us know what you find out from Larry.
Okay, how about we move to 5 Powers Road?
Well, how about Mark Adams?
we got
He's
Mark here.
263
Yeah.
West Street.
Mark, are you listening?
Yep. Hey, how's it going? I'm here.
Oh, there
Um,
you are.
Sue, I don't know if you'd be able to find the 263 West Street plans for the tight tank from Jack Maloney, probably a meeting or two ago. You know, if not, the board's already seen them because we did view them the night.
Yeah, we've
Right.
already seen them a
Yeah.
couple of times.
Yep. So the final revised plan shows 2 6,000-gallon tight tanks. Mark has recorded the board's approval as required by Title V. So
Saw that.
tonight, we would be looking to issue the permit to install.
Yep. I have no problem.
I
Yeah.
don't have any issues with it either. I saw the letter that he sent the board.
It looks good up there.
I saw the tanks in the ground.
Yeah, nice heavy covers.
Yep, so
I
if
have no
that's the
problem.
case, I'll draft it and sign it.
Okay,
Yes, please.
No, this was a hearing, we're gonna vote or not? No,
No,
Nope,
no,
this is just the final step.
because
For
we
the
already
permit.
vote, yeah, on the variances, yeah.
we just wanted to see his face.
At least he's smiling a
Just
little.
say handsome face because they'd all get jealous, yeah.
Yeah.
well,
You're
he's got
getting to the
two,
end of the
two
road there,
6,000
kid.
gallon tanks to cry into now.
Oh, man. You got him in, I tell you, it was a little bony, but you got him in, huh, kiddo? Yeah,
Yeah, it worked out.
yeah.
You had to hammer some
Terrific.
ledge?
Ledge, water, we dealt with a lot, but
Oh, really?
Yeah.
all worked out, so.
All right,
Very
good.
good. Well, hopefully you get further into business there, kid.
I know, we're getting there.
All right, Mark, so you're all set. Have Timmy call me.
All right, thanks a lot, appreciate it.
Yep.
All
good
right.
night.
Have a good
All
one,
right.
kid.
Bye, guys.
Okay. Now, do you want to see 5 Powers Road
Absolutely.
Sure.
before I forget how to do it again?
We looked at
This
it
was
once.
on last meeting, but again, I just brought it before the board in case there were questions.
Yeah.
Since I was not there.
Well, we thought it was all right, unless you had any questions, Billy.
Again, it was previously permitted, installed, and just never signed off because it was never tied to a house, so it's really just a
Yep.
a reissue of a previously issued permit. I just need to just run through the approval from the state on the Caltech units just to make sure nothing's changed. And
Okay,
if that's the case, again, I'll draft and sign the permit.
Yeah, this was just the reissue, so.
Yeah, so
Right.
basically, I don't know if you can scroll down, you can follow that force main. Sorry, other
oh,
way.
yeah. And down, there's the 2 tanks, yeah.
Yep, so if you follow that force main from the 2 tanks, it should show that,
Okay.
there it is. So there's the cul-de-sac Powers Road. And you can see that series of rectangles there, that's the Caltech bed that's in place. So nothing else is installed.
Oh,
just
yeah,
that
yeah.
Caltech bed.
Yeah.
The well is in place. We
Got a
did
reserve
retest
too,
that.
huh, Billy?
What's that?
It's got a reserve, it does have a reserve.
Well, yes,
huh?
it's a new lot, absolutely.
Yep.
Yeah.
When was that Caltech system put in?
Let's see,
Just curious.
that was
Yeah, right.
installed
Could have changed.
in, where's my permit? '08.
Oh, wait, wow.
Yep. So I think the engineers uncovered ends of it just to verify elevation. Again, I just need to run through the DEP approval of that unit. And they've retested the well, so once this permit's issued, they want to move forward with the building permit.
Okay,
Well, what's the tank there already, Billy? What is it?
There is
This
no
isn't-
tank, just the bed right now.
Oh, because it says remove existing tank, or is that from an old lot or something?
What does it say there?
Right next to the bed, kinda.
Oh, you know what? Yeah, you think you're right. They apparently, you're right. They actually did install the tank, but never tied it to a foundation, and therefore it was not protected by a certificate of compliance.
Oh,
So I think
see.
originally that the house was gonna go kind of where it says connect to main, force main.
Yeah.
So they were gonna, I think, have just a gravity, foundation to gravity to that tank. Obviously, they're pulling the house back away from the cul-de-sac. And due to
Right,
its
right.
elevation, need to now have a
Yep.
pump chamber to pump to the system. So you're absolutely right.
No, I just caught it and I'm like, I didn't know if it was from an old lot that pre-existed there or that's.
No, I think at the time Mark Rhodes installed the bed and the
Right.
tank for the house that was proposed there at the time, which probably
Yep.
fell where the garage is now, and it would have been gravity.
Sure. Yep.
But now
Okay,
that they're
I
ready to
still,
build,
I'm okay.
it's kind of a different layout.
And how long's the sewer line, Billy? Just for grins? Do we
Yeah. It's
know?
under our 400, but let me take a look.
I shouldn't have asked. It's all right. Doesn't matter. It's short enough. Short enough for me. I just gave him more room in the yard there. It's kind of nice.
It is
Look.
194 feet.
Very good. Okay. I'm okay with it.
So that takes care of 5 Powers. 220 Lancaster Road is a septic tank and D-box permit. That is for the ranch that's now a nice 2-level with a garage on the side. It's part of that building permit. We did
Oh, yeah.
require a new
Oh,
tank
yeah, yeah.
installed.
Yeah,
And
yeah,
when they put
we
the
saw.
tank and tied it to the box, they realized the existing box was corroded, so it ended up being a tank and a D-box permit. I looked at that on Friday. It all looked good, and again, we'll follow the paperwork.
Very
Okay,
good.
And then our last permit, I don't know if this made it, it's handwritten on my agenda, so I don't know if it made it to Sue's list, but 247 Linden Street.
it's on our agenda.
Great. Yep. So there's a Title V down below, 247 Linden Street. That's kind of that 3-family on the bend across from, is it Skep Farm there? The lilies, the day
Yeah.
lilies?
Pulsifer's old. house.
Pulsiver's
yep.
property.
Exactly. Yep. So that needed a D-box. Everything else looked good in the Title V inspection. So I actually was out there with
Good.
Paul Wheeler today, taking a look at the box, and they're anxious to close. So based on tonight's approval
That-
of the permit, I can move forward on the certificate of compliance.
Any conversation or information on how many family that is?
Well, yeah, it was
Yeah.
approved for a 3-family, 8
It
building,
was.
8-bedroom total. So it is approved for that use. Yep.
Okay.
It is. And, well, Title V, it passed Title V, huh, Billy? Yeah.
It did, except for the D-box. Yes.
Yep, okay.
All right, how about, since we're on Title V, 57 Summer Road?
Yeah, 57 Summer and 8 Keys are both passes, but I do want to take a peek at groundwater elevation on abutting lots because the soil description in the reports, it sounds like water might be higher than they're using. So I do need to investigate that and ask for additional info if needed.
Okay. And you have a tobacco permit for BJ's.
Yes, I do. So that will be, I've got the check. I will get that to Donna, and once drafted, I will get that to the board for Paul to sign.
Okay. And you wanted to talk about 24 South Street,
244, actually.
244.
Yep. That is, believe it or not, the existing house where a new lot was subdivided off of it, new house built.
Oh,
Title
yeah.
V had to be done on that house and it failed. So they were under an order to correct within 2 years, and believe it or not, that 2 years has gone by. So we need to issue a letter to the owner asking or telling them that their 2-year window is expired. and
Was
they
that
need to move
Chris-
forward.
Christine Flynn? Was that?
Yes, I
Flynn's?
think
Well,
that's what it was, Bobby. Yep.
Yep, and
up
I
on the
think,
hill there, yeah.
was it daughter and son-in-law, I think, built up behind, so
Yeah,
Um,
to the left, yeah. Yeah.
it's just hard to believe 2 years have gone by since that was done.
Right.
So we do need to
Yeah.
kind of see what's going on out there.
Okay.
Okay.
So you're gonna put together a letter?
Yeah, again, I'll draft that and have it over there for your signature.
Okay.
Okay. Bellevue Road, any update on that?
Well, the last time we were going to meet, I think maybe Paul can give us some info, but he was called by the attorney's office that had previously represented the owner. So tonight, I'd like the board to determine a 30 or a 60-day window, just something I can put in the next notice to when that condemnation hearing will occur, and I will copy the attorney on it.
Okay, a heads up
Think
to
we
both
move-
you, heads up to both you, Bill and Donna. I spoke with Attorney Bailey. And I think I copied you on the email I
I
sent.
did
to
see
Bill.
the email, yep.
Okay, that he told me that, part of the professional protocol is that he needed to check with the former attorney that used to work out of his office, as well as Mr. Mills, to find out clearly what the status was. And at Bill's advice, I asked Bailey to send us a letter just summarizing the process that he was going to go through in terms of, well, handing it off or whatever, deciding to move ahead. He didn't know anything about it, which says something about his former fellow counsel that worked for him. But we haven't seen an email from him, have we? From Robert
I have
Bailey?
not seen anything.
All right, I'll call him tomorrow and talk to his secretary and see if we can light a fire under his feet, just so that we
Okay,
have
so
that for our
You want to
record.
hold off on setting a date then until we get that information?
He told me it might be as much as a month for him to do that process, and
Yep.
now that's approximately 2 weeks ago. We can
Mhm.
set a date, but in all likelihood, we're probably gonna have to change it at some point.
Yeah,
But,
why don't we sit tight then?
okay,
All right,
that
We'll
works.
keep it on for next meeting then and see if
All
we've
right.
heard anything. If
Yeah.
not, we may just have to set a date and copy him on the letter.
Well, I
And
thought we had
last-
moved it out, we moved it out to the 22nd of November to speak with you, Billy, even to get you to figure out what we did need, so probably it might go further than that.
yeah, it could, because we have to make sure an attorney's are involved. All
Correct.
right, that brings us to the last issue, Coburn Road mitigation status.
Yep, so apparently there's a fence being installed with sound deadening blankets or whatever they call them. Which is one of the items mentioned in the mitigation plan, but I think, maybe we had discussed putting a time frame on the movement of the operation, which was also listed in the mitigation plan, and I think we had talked about sending a letter to the owner and the selectmen that should be done by next license renewal period. which is
License,
May.
right, license procedure.
Well, I can testify they're putting the fence in, because every day I hear the bum, 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 bum.
Yes,
And I believe the neighbor has complained about that noise as well.
yeah, Richard's been involved in that so far. Yep.
I know that somebody said that they're waiting for lumber for the fence itself too. That it's ordered and it's on its way, so that part, I don't know much about anything else, but
Yep, and I did meet with Kristen, the new town administrator, today on both Coburn Road and Bellevue Road, so she's well aware of the situations and,
very good.
brought her up to speed and told her, town council might be needed, so she's aware and I told her I'd keep her posted.
Very
Very
good.
good.
Do we have any other dangling issues or new business?
None that I know of.
I do not.
Bill, we got the message that the test kits were more in the office or somewhere. huh?
Yes, they're hiding
Yep.
behind the plumbing inspector's desk. There's masks
Oh.
and test kits. Yep,
Yeah.
Okay, are we supposed to be distributing the new ones now, or what are we doing with
Absolutely.
the old ones?
Yeah.
Okay,
currently
the
the
old-
expiration date is January of 2023, so get them out there.
Okay, but
right.
what about the ones that we already have? Are they gone by yet, or are we gonna
Nope.
try and push?
No.
No,
They're
I
all the
think so.
same.
Okay.
Those are good, but Christine or somebody for the Council on Aging, they might need a few, fire, police.
Victoria. Her name is
It's
Victoria.
Victoria.
Oh, I keep messing her up with the other one. I'm sorry, yeah.
That's okay.
So Victoria and maybe the fire chief or
Yeah, I
ambulance might
told
need a few.
Victoria she could get rid of the old ones. I didn't realize they're all the same date.
Yeah, as far as I know, that last email addresses, it's the same lot,
Yeah,
if you
I'll
will.
grab a box for the library, and I'll grab another box for 19 Carter, and I'll give
Yep.
Victoria another box, so.
Okay, and you said there were masks in there too?
There's adult and children's masks, yes.
Okay, because I had forwarded an email to you guys that the new town administrator was looking for more masks for the lobby. But when I was there Saturday, that little container was full.
I
Mhm.
Yeah,
noticed
So
that- I noticed that the day of that email, I went in there later in the day. and
Yeah.
It was jammed with masks, so.
Yeah,
Right, okay, so that's,
Chief Clark may have had a reserve, I don't know.
okay,
Right.
so then, all right.
All right, I'd like to make a motion to adjourn this meeting.
I'll second that.
Okay,
All in
Oh.
favor? Sue,
aye.
Bobby,
Aye.
Paul, I as well.